I mean, like, on most nights, I'm up to like 1 a.m. Isn't there a medication you could give me for that? I absolutely could, but first I just have one question. Okay. Is your sleep hygiene in a state of expansion or contraction? What? Welcome back, you're tuned in. I'm Eric Lascano. Let's begin. In this video, we're covering the fourth part of the answer on how I manage my stress levels as a psychiatrist. Battery recharging is the long and short of it, and I mean fully recharging. How do I accomplish that? Sleep hygiene and an unwinding routine. Consistency is key with sleep hygiene. One example of what that would be is going to bed at the same time every night and waking up at the same time every morning. An unwinding routine is basically a protocol we follow every day of the week at the same time. It designates the beginning of when we want to start winding down for the night, and typically it's something like 30 minutes. It could be longer or shorter depending on how much time we have available. Of course, medications, over-the-counter supplements, these things have a role. I utilize both of them in clinical practice when helping patients get better sleep, but we also have to ask ourselves, what other pieces of the pie might we be missing? And that's where these two components come in, sleep hygiene and the unwinding routine. So in this video, I'm gonna give you 6 strategies to get better sleep. And I'm giving you 6 because it's one for every sense base that we have. So mind or thoughts, bodily feelings or sensations, hearing, seeing, smelling, and tasting. So without further ado, let's jump right in. We begin our 6th sense unwinding routine with strategy 1. For feeling body, hot shower. Not a burning hot temperature, but like a sauna experience. Muscle relaxation is a byproduct. Think E for exfoliation. The old you is fading away, the new you is emerging. 10 to 12 minutes duration here. Evidence-based medicine sleep hygiene pro tip. While you're warming up in the shower, cool down the bedroom temperature. Strategy 2. For thought content. Inject positivity. This can start while you're in the shower. In addition to exfoliation, I want you to think of 1 to 3 things that went well that day and your role in them. Repetition is key, so let this 3-item list marinate for the entire length of the shower if possible. Sleep hygiene pro tip. If generating a list is too challenging, swap it out for positive affirmations, performed in front of the mirror, either out loud or through mental rehearsal, or by journaling the affirmations. Strategy 3. For hearing. Ambient sound. Grab a speaker or headphones, put on an ambient soundtrack. Think Celestial. Here's the album Mindfulness from Grammy winner Paul Averiginos. You can start the soundtrack during affirmations or before the shower, with the option to turn it off when you're actually getting ready for bed. Sleep hygiene pro tip. At bedtime, you may find playing a soundscape like white noise or ocean sounds can actually help you sleep better. Strategy 4. For seeing. Ambient lighting. Dim your main lights down, spark up the ambient lighting. You can choose to set the mood before the above 3 strategies. Dealer's choice. Sleep hygiene pro tip. Avoid blue light by putting devices into night shift mode and or using blue light filter glasses. Cover lights shining from wall chargers and external devices. During sleep, you can also black out your curtains or use an eye mask if it's comfortable. Strategy 5. For smelling. Lavender essential oil has been shown to promote tranquility and decrease anxiety. Before applying directly on the skin, make sure you dilute it to avoid skin reactions. Option to use lavender oil with a diffuser, although I prefer the palm method because I can scale how much I'm breathing in and because it helps me hone the attention on the nostrils for the in-breath. 1 to 3 breaths is good for starters. Speaking of nostrils, sleep hygiene pro tip. As soon as you lie down on the mattress, in 3 breaths, move as much air in through the nostrils as possible with 3 over-exaggerated in-breath. This will stretch your diaphragm and induce the body's natural relaxation response. Strategy 6. For tasting. Glass of milk. Source of your choice. You may prefer warm over cold. Sleep hygiene pro tip. Avoid eating a large meal before bed, but don't go to bed starving either. Keep it balanced. This entire 6th sense unwinding routine is roughly 20 to 30 minutes, but can be scaled in either direction for your preference. I would recommend at least one night using all 6 of the above to prove to yourself better sleep is possible, then scale from there. So there you have it, the 4-part answer on how I manage my stress levels as a psychiatrist: upstream prevention, dropping anchors, counterbalancing, and battery recharging. If there's a question you want answered on the channel, make sure you leave it in the comment section down below and subscribe for ongoing mental health gains. Stay tuned.